Hi, in today's post we're going to be talking about the difference between gluten sensitivity and celiac disease. See, celiac disease is just one component of gluten sensitivity. Celiac disease is the autoimmune process in your intestines to wheat or gluten, gluten being the protein of wheat. And in other posts I've talked about all the different components of gluten that aren't being tested these days in a typical lab. So if you've been tested and been told that you don't have gluten sensitivity, that may not necessarily be true. So in celiac disease, they're looking for certain markers on your blood. They're looking for things like alpha-gliadin. They're looking for transglutaminase enzyme antibodies. They're looking for endomyocele antibodies. But the gold standard for determining whether you have celiac or not is doing a biopsy of your intestines. And what they're going to be doing is they take a piece of tissue out of your intestine to look to see if you have villus atrophy. And what villus atrophy is in the intestine, in order for you to absorb nutrition, there are these villi or finger-like projections. It looks like a shag carpet. And when there's villus atrophy, in other words, the atrophy means that those villi are being destroyed, what is happening is that your body will end up not being able to absorb nutrition. A lot of inflammation is produced because of the autoimmune reaction that's going on due to the celiac disease. But you do not have to have celiac disease in order to have gluten sensitivity. So look for a previous post where I broke down for you in very great detail all the different components in gluten sensitivity. In gluten, there are many different components. There's up to 24 different pieces that can be looked at, and in a standard lab, they're not looking for those things. So you could have sensitivities to gliadin, and there's actually 4 types of gliadin. There's alpha, delta, gamma, and omega. There are 8 different types of transglutaminase. There's things like wheat germ agglutinin, there's glutenin, there is prodynorphin, there is gluteomorphin. And if those components are there, that could mean that you have gluten sensitivity and not necessarily have celiac disease. So if you've been tested and you've been told that you do not have these, you don't have celiac, does not necessarily mean that you don't have gluten sensitivity. So especially if you've not cut it out and you still feel horrible because you were told that it's okay to eat it, I would think again and potentially look for a doctor who understands this concept so that they can test you appropriately so that you can get to the bottom of whether you have a gluten sensitivity or not. Now, gluten is very much related to a lot of autoimmune diseases. It's related to Hashimoto's thyroiditis. There's relationships into celiac, obviously. There's relationships into multiple sclerosis. There are many different aspects of gluten sensitivity that are related to the problems. Now, you could have celiac disease that is what is called atypical celiac disease, which means you don't even have any digestive symptoms. So that's the other thing. You could have celiac disease and not even have any digestive symptoms. You could have gluten sensitivity and not have any digestive symptoms. So you do not have to have symptoms in your digestive tract to have a gluten sensitivity. That's a big misconception also. So you need to find a doctor that understands these concepts to fully understand what's going on, to get you tested appropriately so that they can get to the bottom of whether you have this type of food sensitivity. So I'd like to thank you for watching and make it a great day.